Hello and good morning, everyone. Hope you all are safe and in good health. So we welcome you all at the third edition of Health Tech Conclave, which will see eminent speakers from healthcare industry present here to discuss and deliberate around leveraging technologies and transforming public healthcare delivery systems, reimagining healthcare through innovations, future hospitals, health quality, and patient experience. As we all know, healthcare has become one of India's largest sector, both in terms of revenue and employment. Healthcare compromises of hospitals, medical devices, clinical trials, outsourcing telemedicines, medical tourism, health insurance, and medical equipment. The Indian healthcare sector is growing at a brisk pace due to the strengthening coverage, services, and increasing expenditure by public as well as private players. So if we talk about the market size, the healthcare market can increase threefold to rupees 8.6 trillion by 2022. In budget 2021, India's public expenditure on healthcare stood at 1.2% as a percentage of the GDP. Health insurance is also gaining momentum in India. Indian healthcare system is much diversified and is full of opportunities in every segment, which includes providers, payers, and medical technology. With the increase in the competition, business are looking to explore for the latest dynamics and trends which will have positive impact on their businesses. The hospital industry in India is forecasted to increase to rupees 8.6 trillion by 2022 from rupees 4 trillion which was in 2017. Also, the government is planning to increase public health spending to 2.5% of the country's GDP by 2025. India's competitive advantage all lies in the increased success rate of Indian companies in abetting abbreviated new drugs application approvals. India also offers vast opportunities in research and development as well as medical tourism. To sum up, there are vast opportunities for investment in healthcare infrastructure in both urban and rural India. With not taking much of your time, I would like to start this panel. Uh, so with this, I would like to welcome our panelist, Dr. Shafqat Khan, who is the moderator. He'll be joining in with us in next 2-3 minutes. So he's the officer on special duty, Department of Health and Medical Education, UT of Jammu and Kashmir. Then we have got Dr. T. Arun, Secretary, Department of Health and Family Welfare, UT of Puducherry. Welcome, sir. Then we have got Mr. Sunil Kumar, who is the Head Healthcare and DDG, National Informatics Center, Ministry of Electronics and Information Technology, Government of India. Welcome, Sunil, sir. Then we have got Dr. Abhishek Roy, who is the Head SeMT, Department of Personal and Administrative Reforms and E-Governance, Government of West Bengal. Welcome, Abhishek Roy, sir. Then we have got Professor Ravikant. He is the Director, AIIMS, Rishikesh. Welcome, sir. And from the industry, we have got Mr. Subramaniam V, who is the National Head, Sealing Solutions, Knauf Sealing Solutions. Welcome, Subramaniam, sir. So, with this, I would like to, it's like as Dr. T. Arun has a meeting, I think so at 11. So, I think so, sir, we would like to hear from you about if we talk about the leveraging, it's like how it's like the public healthcare system delivery systems are, it's like leveraging through technologies and transformation. If you can start with your opening remark, then we can it's like slowly move on from your to another speaker. So, I think
Yeah,
so. Over to you, sir.
yeah. Thank you. Thank you. It's a great opportunity to share the virtual dias with all the eminent speakers. In fact, I wanted to stay for a longer time, but because of there is a VC with the government of India, so that's the reason why we had to begin. But I'll again come back for this for other sessions just to listen to the experts. So the topic is very relevant. When it compares when it is been the where the how the technology is being involved in enabling the healthcare. Government of India, in fact, just a brief about the digital health mission, which they have called National Digital Health Mission, where the digitization of even the patient's care. I'm sure even in Jipmer and AIIMS, there is a, the each and every person has been, digitized, the hospital records has been made. This is one efforts which the government as India has taken forward and only initiated at the UT level. Hopefully in the second phase they might, they might do it for the other states also, I was told. So this is one aspect. And during the challenging COVID times, we have seen how technology has helped us, be it triaging. Even today, the triaging through teleconference involving the app based triaging, this has helped us a lot in the delivery of the healthcare services. And this has helped in transparency also. A simple dashboard about bed availability, a simple dashboard which shows about the number of cases, where are the hotspots coming. This has really helped in enabling, the healthcare services available to the people. Apart from that, it has IT. We have seen IT has helped even the health department also to getting in, in making the services much easier. In fact, in Puducherry, we started with the triaging, the isolation and monitoring, and also along with that IVRS. Say for example, I'll just take 2 minutes to say about the initiative, which also was widely recognized, and we got some awards also, from the government of India and all. It is nothing but the triaging happens by the, of course, by the at the COVID focus center and also at the home level, but it would be reconfirmed through a simple telephone call, through a simple dashboard where, where who is contacting whom. Accountability is fixed on the person who is contacting, say the doctor, to the persons. So as of now, we have contacted more than 1.5 lakh people who were all in the home isolation. Day one, a person will call, the doctor will call. From day 2 to day 15, there would be a automated IVRS system. If they are not taking up the call, again a reminder call will come after 2 hours. If 3 calls fail, automatically a ticket would be generated, and the healthcare services, it would activate our health team, the zonal health team. They will go to the place and they will pick up the persons, whoever is not attending the call or whoever is having the symptom. This is a very simple intervention which has helped us a lot. So technology is the key. Apart from that, a simple bed management system where the beds are available, which hospitals beds are available, through openly available for the dashboard and also for the war room. These are all the technologies which has helped, which has increased the transparency, which has increased the faith on the system, faith on the administration. So technology is a very, very key with respect to the, to make the government function in a better way. And a simple, even not just for the COVID times, even in the other diseases, for other notifiable diseases like dengue, chikungunya, what we have done is wherever the cases are coming, automatically the dengue, chikungunya cases, the spots, as per the public health point of view, those are considered as the hotspots. Automatically, the system, the fumigation activities would be automatically initiated. The source segregation would be identified. The team, local administration, municipalities would be alerted where all the, the sources are there, where water stagnations are there. PWD would be activated to immediately rectify those. So these are some of the intervention which has really helped, and digitization of the records. Say at a periphery level, we would be, other initiative is at the periphery level, we are taking some of the imaging like X-rays and all. We need not wait for the copies. Automatically, it will be coming to our dashboard, and the radiologist will see, and they will give the feed, and based on that, the patients can be channelized. So technology is a very important tool in ensuring in ensuring the health services available to the people seamlessly and also faster way, and it has increased the transparency. So I'm very happy to be here to share my experience, whatever at Pondicherry level. Apart from this, even the availability of drugs, remdesivir. Now the remdesivir is this one, but apart from that, other drugs can also be available at the dashboard. Who is getting what, where it is being getting, who has it been given. A simple vaccination procedure where technology has, we have seen technology, how COVID portal has helped the vaccinating the entire, people getting vaccinated. More than 17 crore people have been vaccinated in India, which is simple, which is very seamless. this vaccination, this portal, the success of this portal is, the entire success of this vaccination program is because of the portal. Otherwise, you cannot imagine how much wastage would have happened, how much diversion would have happened. We cannot imagine the amount of the hue and cry for that. So a simple technological intervention has shown us the way. It is very crucial at this point of time, leveraging the technology. Only technology can help in better services. And now health technology in involving the initial days, we used to involve technology for other services like ration card, food system, where we had seen the benefit. Now we are involving the technology to see the benefit in the healthcare delivery system also. It's a very open, it's a very it's a very good step in that regard. And technology, we have to leverage the technology as far as possible. So I think I should not take much time. We want to listen to others. So thank you. Thanks a lot. Thanks a lot for this opportunity. I'm sure all the persons would be able to listen to others also. Thank you.
Puducherry, and how you're. Thank you, sir. Am I audible? Thank you, sir. So the way you talked about the digitization process and how Puducherry has worked towards the towards the COVID, and how you are how the government is helping with the help of the technology for this for the to help the the pandemic to fight with the pandemic is commendable from your end. And the way you talked about the the COVID portal, which the government has launched, and the way it has helped tracking and delivering the services. And so that's actually really a commendable job. So I would move to Mr. Sunil Kumar. So, your views on technology, how technology is leveraging the public sector. So we'd like to have an opening remark from your end on this, sir.
Am I audible?
Yes, sir.
Okay.
Yes, sir.
So at NIC, we have been providing IT support to Ministry of Health and Family Welfare, Government of India, and to state governments. So we have developed many applications, and if we categorize all such applications, we have two categories primarily. One is on the hospital side, which takes care of internal functioning of the of any hospital, and other services are program specific, that is vertical national health programs, which need to be monitored at state level, district level, that to up to PSC and CSC, and in some cases it is up to sub-center level. So those are the national programs. Those are vertical programs specific to that particular programs. And on the first category, NIC developed 4 solutions which are currently implemented in various hospitals. One is basically a suite of e-hospital which is comprising of 4 applications: HMIA solutions of e-hospital, then online registration system, and third is e-blood bank. Fourth is collab DDS, that is tele-radiology solution. Apart from this, NIC has also developed a telemedicine solution, which is being used by various hospitals across the country during the COVID times. And as far as national programs are concerned, we have developed a lot of applications. If I name few of them, it is reproductive and child health, which is mother and child tracking system. And the second is central government health scheme, CGHS scheme, through which all the beneficiaries are monitored and their electronic health record is being created since last 10 years. And apart from this, recently NIC has joined the hands with the ministry on monitoring of non-communicable disease. So this solution was developed by Dell. Now NIC and Dell jointly working on this solution, so that we can make it future ready program and integrate with the external system as well. And apart from this, Pradhan Mantri Jan Arogya Yojana, one system which is popularly known as BAS, Beneficiary Identification System, and that has been used by NIC, and more than 10 crore beneficiaries have already been identified using the Aadhaar in this scheme. Apart from this, we have, as you know, all of you know, NIC recently, after before 1 year ago, this Arogya Setu was developed, which has been downloaded by 17.6 crore people across the country. And COVID-19, NIC has been supporting the COVID-19 portal, which is executed and monitored by Ministry of Health and Family Welfare. And apart from this, we have been providing services to ICMR lab also. So if we see using these systems, we have been providing some online services and some counter-based services. Although they are IT supported, but they are counter-based services. If we name a few of them, online applications like appointment system in ORS is one of the services which is adopted by more than 300 hospitals, and more than 40 lakh appointment has been taken using this software. And using the same portal, that is ORS portal, citizens can view their lab report if that hospital is onboarded onto ORS. Apart from this, online payment has been facilitated, and they can view the blood availability in various blood banks also. And in some of the hospitals, they have initiated the process of OPD card generation using this service. So these services are primarily for the citizens. They can take the services while sitting at the home. And offline services, as I told you, that more than 400 hospitals have implemented e-hospital solution, which has primarily 10 modules. And those modules like OPD registration, IPD admission, IPD transfer, IPD billing, and OPD billing, and lab reports, radiological services, and pharmacy. So depending upon the adoption by the respective basically hospitals, these services are counter-based services. So apart from this, we have blood bank, blood camps are held. So registration by the citizens in online manner is also another service. So the crucial point is, how do these application they talk to each other? In most of the cases, such applications are independent. They are silos in nature, but integration has happened since last 6 months or 1 year, when Government of India took a decision of National Digital Health Blueprint, and an organization called the National Digital Health Mission has been created under National Health Authority, Government of India. And they have basically initiated 5 building blocks which are already operational. They are Health ID for 5 UTs, as mentioned by Dr. T. Arun. And apart from this, they have basically launched health facility registry also, and then DigiDoctor, which is a registry of doctors in 5 UTs. And apart from this, individual personal health record in the form of electronic medical record can be seen through PHR app. And the 5th one, which is very important, that is the ultimate objective, that is the consolidated health record of a patient in electronic form is the ultimate objective which government of India wants to achieve. And these applications which I have mentioned, developed by NIC or by Ministry of Health and Family Welfare or by other organizations or by private sector, they have to they need to be the record, the electronic health record, which is already captured through this application. They need to be integrated. So for that to happen, Government of India has taken various policy level decisions. In 2016, Government of India basically released EHR standards, and in 2017, National Health Policy Government of India released that, and it clearly mentioned the digital initiative to be taken by at the Government of India and the state levels. And in 2018, MDDS metadata and data standards were launched, and 2019 National Digital Health Blueprint was. So every year there are efforts that the health record of the patient should be digitized in one form or the other, and now effort is how do we integrate such created electronic health record in the silo system. They should talk to each other. So we have already made efforts to implement health ID in non-communicable disease, in RCH, and in e-hospital. So under the e-hospital project, we have already able to integrate the 4 hospitals. Initially, they are able to, the patient of those 4 hospitals, they are able to see their health record, which was available in computer only, so they can see on their PHR app. So using the NDHM framework building block, which they have already released. So apart from this, these lots of standards have been released by Government of India. Standards on identification of the patient, terminology services like SNOMED City has been adopted by Government of India. Coding system like LOINC has been put in place, and imaging standard like DICOM has been adopted by Government of India. So scan image, in which format they have to be stored, and how the data exchange will take place. So HL7 and FHIR, these standards have been notified by Government of India. Access mechanism, how the digital software digital signatures will be applied in the while creating the electronic health record. So there are a lot of initiatives which are happening around. Now this year, I think we will achieve many applications. They will start talking to each other, and electronic health record will become in the hands of the normal citizen. So that was my views on this. Thank you.
Thank you, Sunil sir. So basically, it's like actually, if you talk about NIC, I think so they are the backbone behind the technology which is being provided to the public healthcare sector, right? So it's like the public hospitals and all. So where you talked about the e-hospital, the online registration, e-blood bank, teleradiology, telemedicine, and basically, and at national level, NIC is like doing a great job with regards to supporting the public healthcare system. The it's like the kind of health IDs you're talking about, the health facility register, the DigiDoctor, electronic records, consolidated health records, and the digital signatures which you recently talked about. So I'll move to our next speaker, Dr. Abhishek Roy. Sir, your views on how technology is leveraging the public healthcare system, like it's like how West Bengal is doing in terms of the healthcare, the technology, it's like what kind of technology they're adopting, and how it is, it's like how they are being able to fight this pandemic. Also, if I can put in to go, it's like how technology is helping you all to fight the pandemic in West Bengal, sir. Yeah, over to you, sir.
Yeah, I would like from Dr. Bhusan. So the way he told that there are many applications built by NIC, but he also agreed that most of the applications are not talking to each other. Before coming to West Bengal, I would like to add that definitely if used properly, technology can change the whole paradigm in the health industry. Now, taking the example of CoWIN portal, no doubt, CoWIN portal was one of the best to have the entire vaccination, such a biggest in the country, biggest in the world vaccination drive. But there have been cases where So people have booked an appointment on CoIN portal. They went to that vaccination center and the vaccinations are not available. Neither the time schedule have been maintained. So there were initially two time schedules, forenoon and afternoon. So if I'm booking a slot, I'm going in the forenoon session. And if I have to wait till the afternoon session, what is the use of this technology? If I'm booking a slot after finding out and all those things, and if I'm reaching the center and the vaccines are not available, then what is the use of the technology? This CoWIN portal has helped a lot, but the biggest issue is that we don't talk to each other. Everyone thinks that they are the king. They create an island in this technological arena. So with this island, if they don't talk to each other, the entire concept of using technology in health sector will be diluted. So if the this inventory management of this vaccines has been also integrated with CoIN portal, and suppose by any chance because of some logistic issues, some vaccines have not reached the center, an alert and SMS should have gone to that person. Okay, uh, today the vaccines are not available. Please come tomorrow, or your appointment has been rescheduled to such and such date. Then it would have helped. Now, we have already got the first dose, and the second dose are due. And basically, the second dose maximum timeline of 6 weeks for Covaxin and 8 weeks for Covishield is basically going to be over now. This overdue. So we're trying to find out those people, track them, and trying to give vaccines to them on priority so that their maximum timeline is not uh, overdue. But we are not getting the data because of this interconnectivity issue. To catch hold of them and go and give it to them. So the entire story is about data. So that data needs to be integrated with different people. As Mr. Bhusan told that many applications are there, and but they are not in silos. Now coming down to the EHR standards and all. So but the entire country has to follow the same standards. Either it should be HIPAA or talk to each other. The entire concept of EHR is that suppose if I have uh, visited a doctor in Delhi and now I'm coming down to Kolkata, so my EHR records should be made available and it should be interoperable so that in Kolkata also my old entire health records can be seen and then utilized for a better COVID management. And coming down to the West Bengal pandemic management, we have basically in health sector we have started using technology a lot of things pre-COVID also and post-COVID also. So in COVID, and basically during COVID, we have launched apps for this isolation management, wherein we are tracking that the person who is home isolated is not moving beyond a certain distance. So their GPSs are on, and then the moment his movement is beyond some 100 meters, so an alert is sent to them to be inside the particular place, not to move. And then again, if he's not listening, if the movements are very high, we are sending healthcare workers to them. But there are people who dilute this. Suppose if I keep my mobile phone in home and then start roaming around, then what? But we are trying to use the technology in the best possible way. In fact, for this lockdown management, to basically curb the crowds, we are using drones. So drones are being basically used to see and maintain the crowd at public places and the markets. And based on the pictures, we take necessary action. Public announcements are being done to minimize the things because COVID is spreading in the second wave, then third wave is expected. It's the citizens who can control it, apart from the technological things. As far as the technology is concerned for the hospitalization and all, we have all the 4-5 modes of communication. Initially, we started a inbound call center. There's an outbound call center based on the COVID positive report. There's an outbound call center. A call goes to the person. We try to take the basic parameters of the call. There is a app and there's a WhatsApp bot. So all these modes, any COVID portal can enter their details. Basically, they can filter it out and see the type of beds they want. Suppose there are around 500 plus hospitals. So suppose if I need a ventilator bed, so there are filters just with one click with the WhatsApp bot and other thing that a ventilator bed is needed. It will be show the ventilator beds available in and around that person based on the pin code. And when the ventilator bed, he can directly contact the respective hospitals, or he can fill up a form. There's a form with basic parameters with all those comorbidities and all the other parameters are captured there. That form comes to our centralized health center where we have an algorithm to prioritize the forms. So based on the some parameters, suppose if someone is having a temperature of 102 plus with SpO2 of around 80 and with all the comorbidities, he will be given the first priority. So because we have thousands of the data coming every day, yesterday 20,000 plus COVID positive cases were found. So based on the entire thing, we prioritize the applications and a doctor calls the patient. A doctor basically analyzes his situation, and based on his situation, a hospital is allocated based on the bed availability and the type of bed he requires. That information is basically sent to him in the WhatsApp bot and the app from through the way he has approached us. And if required, an ambulance is being also sent to the place to the person, and he is being admitted there. So this is the way we are trying to manage it. Apart from that, there are other modes. They can also contact us through mobile and through through outbound. COVID patients in this manner. Now the second thing is that testing. For the testing, the Kolkata Municipal Corporation has started a home-based testing free of cost. So if you feel like that you have something, some fever or some symptoms of COVID and you want to get tested, you are no longer required to come and stand in a long queue at our health centers and spread. Because if you are standing, the biggest issue in testing is that suppose if I am going to a, I am a COVID negative guy, but I have symptoms, I am going for a test. And if I'm standing in a queue with 100 people, there's a high probability of getting infection done. So people don't want to come out. And if a positive guy is there, if I stick him to his home, the chances of spreading is also less. So we have started an home-based systems where anyone who intends to get tested can just give a call, or through a WhatsApp bot he can inform us. Our health team will go to the place, take his samples, and conduct the testing. And then if it's positive, all those processes of isolation and bed and other things will start the way we are doing. Now, the basic, as we can see in the second round, post-COVID complications are very high. In the first round last year, 2020, people were, the person who were surviving for the 14 days and coming out of that COVID didn't have any big issues. But in this year, which I can see and analyze based on the data, the post-COVID implications are very high. Mostly people are surviving in this 14 plus or 17 days period, and they're coming back from a hospital. They are basically enjoying a good life. They're happy that they have conquered the COVID. But all of a sudden, they are getting one or more complications, and most of the times people are not surviving. So this is a new trend in the second wave. So how to basically manage this? In 2020 only, we launched one application called janupchar.com. So in this janupchar.com, any patient can register and get a video consultation done with the top doctors free of cost. So this is basically for post-COVID management, or for the people who have not got infected with COVID, but they have other complications. Because during this COVID period, anyone who is having any other symptoms, any other gynecological or gastroenterological symptoms, they're trying to avoid those, or they're not getting the proper care and treatment. So if they're not getting the proper care and treatment, because they don't want to go to a doctor. Doctors are also not available. The chances of spreading out COVID if they're going to a doctor. So we started this last year, June, July only, this janupcha.com, where we requested top doctors. All the top doctors are giving 1 day free to the people. So all top level doctors are available in all the fields, specialties. Anyone can basically come and register to that portal, upload their health records, their basic parameters, and get the consultations done at the we have appointment slots there. At that appointment slots, they can get the consultations done through video consultation. And the platform is built with so agility that if your network comes down from 4G to 2G, then also these connections will not break. And this maybe the video quality will deteriorate, but through chat options, you will be able to communicate with the doctor, and an online prescription is given in real time. It's not that he's just sending a WhatsApp message which does not have an authenticity. A fully digitally signed prescription is being given to the patient in the real time. He can take it, and that health records are also kept there, and with that they can carry on with all those parameters. So this all from my side as of now in the inaugural this introductory session. I have a lot of other things to share. Maybe I'll be sharing it in the next course of discussions. Thank you.
Thank you, Dr. Abhishek Roy. So it's like very well said. The points which you had mentioned, like when we talk about, like you talked about technology, right? So the technology right now is not talking to each other, but I think so. The government, I think so. I hope the government is working towards it and trying to enable those features and all which you had mentioned in with regards to the COVID portal. Also, when you said that it's like the appointments are there, but the medicines are sometimes the medicines are not available. So those information needs to be sent to the basically the patients or who wants to get the vaccination done. Then it's like you talked about data. Data is actually it's like the need of the hour, how it needs to be integrated. That's need to be taken care of. And EHR records, which you said that it's like suppose if there is a patient in Delhi and it comes to Kolkata, so if anyone clicks on his this thing name and any or this thing UHID number, so he can get the all the it's like EHR details. Then you mentioned a very good thing about the inbound and the outbound call centers, which the West Bengal government is using. So it's like I'm a very it's like I'm a live example for that, because I belong to Darjeeling. And last year when I went from Delhi to Darjeeling, so after it's like every alternate day I used to receive a call from a particular department that sir, are you it's like I hope you are okay. I hope you're not facing any fever. It's like or all those things. It's like so till 14 days, every alternate days I got a call from the government department checking on me that whether I'm symptomatic or not. So that's it's like that's a live example. I can tell you that I'm this thing.
Great.
I'm a live example of that. And then you talked about the it's like the priority of giving beds to the patient who is actually in need. So because we have seen during this wave that many people like who are not it's like that needy, they are COVID positive, but whose oxygen level is not that low, they are getting admitted into the hospitals and they are occupying the beds. And that basically it's like and the needy who's in need, they are not getting there. The beds are not available, the oxygens are not available right now. But slowly I think so things are actually improving now. The is like we are like the government is really working towards it. But the person who need it actually must be given the priority, which I think so you must like your government and various other states governments also working on doing it right now, like and then the other thing which you mentioned was home-based testing process, because nowadays, like in Delhi itself, if I talk about the items, the testing which is it's like it's taking time. It's like 3 days time. The booking slots are not available and all. So it's like your government is like if I WhatsApp it, if I send them this detail, they come to the home and they do the test. That's really good work which your government is doing. And the real-time prescriptions and health records also, which you mentioned. So overall, I think so it's like we should all learn from each other, and we should move towards how we can from it's like how we can make this system much better. so we can adopt always. We should always ready to adopt during this. This is actually a tough time for everyone, and I think so this too will pass. So with this, I would like to come to Mr. Subramaniam V. So he is the he's from Knauf Ceiling Solutions. So Knauf, they are basically into acoustics. They're the almost it's like almost all the hospitals in the it's like in the world, in the country. They're providing those technologies. So I'm it's like I talking about Knauf. I think so. Mr. Subramaniam should be the right person to talk in a brief and how they are helping the medical system, the healthcare system. So with regards to the technology, basically, so how Knauf is leveraging technology for the public health, public and private. I'll talk about. I'll not talk about only public because you're into private healthcare system also. So how your technology is helping the overall experience for the healthcare industry. So over to you, Mr. Subra.
Thank you very much, Fahim, and congratulations to all the panelists. Very insightful discussions and a lot of insights around how we could use information technology much better. When it comes to Knauf Ceiling Solutions, one of the important things that we were looking at is how can we bring about better hygiene in the healthcare environments, and two things out here. One is of course the indoor air quality, and the second is the surfaces. So many times what we hear about is hospital acquired infections. A person goes to the hospital for a treatment and comes back with another problem. Probably because many of them are immunocompromised. They have a very low immunity. They go for a surgery. They come back with an infection of something like Aspergillus niger or a similar kind of fungus, or maybe a bacteria, or maybe even a virus. And so we set about thinking, and we have worked with international experts and researchers to come back with some solutions, and very happy to announce here that that we would be very shortly coming back with a lot of different solutions. Of course, Knauf Ceiling Solutions, earlier Armstrong and AMF come together. So quite a lot of solutions that we have already launched in the market, including products like BioGuard, which is basically a biocide that has been involved in creating the panels or the surfaces. So whenever there is an infection, and it has been tested for a lot of bacterial and fungal infections, basically, and some of them are most common and very difficult kind of strains that becomes difficult for the healthcare system to manage, like for example E. coli or methicillin resistant staphylococcus aureus, and these are kind of strains that can become a problem in getting treatments after the person has actually gone through an infection. So whenever our products are used, basically they are very effective in killing, or rather I would say germicidal effect on these kind of strains are very, very high, and it has been tested and proven over and over again in laboratories. And these are products that we had launched. Now, one of the things that came back recently, especially around the kind of infections that are happening now, are most of them are airborne. And we thought a lot about it, and we have worked with scientists on LED technology. And LED is one of the most cutting edge latest technologies that is available in the market today, and we use a very, very special technology called evaporation induced lithography to create LED chips that emit very, very low amounts of ultraviolet C radiation. And the best part about ultraviolet C radiation is that it is very good in terms of germicidal properties, and it is not as bad as UVB when it comes to affecting human beings. And though it is the amount of energy that UVC releases is actually quite high. The reason for this is what we call as the resonance of the cells with the frequency of the light that is emitted, and that's where it's a very, very proven technology. A lot of companies have actually come back with UVC germicidal technologies, but we would kind of differentiate ourselves in the fact that the UVCs that we are working on is a very, very low voltage UVC, and it can be directly used in places where it is exposed. Not directly, maybe not very, very close. What normally happens is that UVC, when it has got a very high output, it normally travels a longer distance. So when we use very low voltage, it's like drip irrigation, basically, right? So when rather than flooding this entire thing with water, we only put it in places where you know that this can actually create a problem. So what we're trying to do is we are trying to work with the ventilation systems, and again, what is noticed here is open spaces generally are much safer compared to indoor spaces with closed kind of ventilation systems, because these ventilation systems are very, very effective in transmitting that disease, COVID-19 today, especially the second strain. So here, when we are actually working with the air delivery systems and creating planes around the air delivery systems, so all the air that passes through that plane would get disinfected. And this is a very, very I would say cutting edge technology that we are working on, and very different from all the systems that are available in the market. The other things that are that we're working with again is we're talking with ideas of surface treatments, because surface is another way of transmission. And many times, somebody coughs and leaves. So there are aerosols that get transmitted both in the air and get deposited on surfaces, let's say tables or chairs or similar kind of places. So and it's impossible for disinfecting these places on a 24-hour basis. You can't have people cleaning around every single minute and assuming that these places are going to be disinfected. So here again, we're working on some chemicals where that could be sprayed around both on our products and as well as some of the other places, basically. And they have a longevity of about 6 months, basically, because they actually increase the wear and tear of the product also. Like, for example, if you're putting it on a wooden panel, the surface is going to get much tougher, because we use products like titanium dioxide, which is a known material which is supposed to increase the wear and tear of the product itself. So the product life is increased, and with the effect of a little bit of ultraviolet radiation on it also, it constantly releases oxygen for a longer duration. And not just that, it is going to also eat up the volatile organic compounds which are there in the room, and thereby making the place much safer. So these are technologies that we're working on. We're coming up with some products. Of course, there are products that we've already got in the market, like the BioGuard, where we could do the wall panels as well as the ceilings in technology that nanosilver technology that can actually kill bacteria. So these are some of the things that we are working on. Of course, I mean, we'd be happy to hear back from all the experts out here and see how we can actually improve and deliver this much better into the market. Thanks.
Thank you, Mr. Subramaniam. So very well articulated talk about how technology is helping the public and private healthcare system. So where you talked about better hygiene, you talked about BioGuard, you talked about LED technology and the indoor air quality and all. So I think so. It's like you and your organization are actually doing some great innovation work into this healthcare sector in terms of taking care of the patients. Because see, when we talk about the hygiene, when we talk about the acoustics and all, so apart from all those medicines and all, which helps the patient recover from the disease, this is actually a support which we can say that this technologies can support them recover in a much better manner, in a much hygienic manner. So actually, it's like a very, 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 very good work actually, Mr. Subramaniam, by your organization. So I would like to come to Professor Ravikant. Professor Ravikant, you are there. Can you hear me?
Yeah, I can hear. I'm with you. Right.
Okay, sir. So good
Welcome.
morning, sir. How are you, sir?
Morning. Actually,
Sir,
I was
I would.
listening to everyone and I realized that there is a utopia and there is a practical thing. My question is, there are central government 30 or 40 hospitals in India. Are they using a good EHR? Question number one. So it's a central government NIC is here, and we have heard the DDG very well, and I see what he's saying about health system. My question is, are they happy with the EHR which they are getting? Is the salary and other basic management is being sorted out? Number two. Number three, when the patient who is admitted in a corona ward, he wants the information. What is the software by which we can give them the information? So actually, when you see at the ground level, at least I know about 9 or 10 new AIIMS, they did not agree with the NIC software for the hospital, and AIIMS Delhi has a different idea completely. It means there is a need of a very good EHR, which will be not only comprehensive, but acceptable. And maybe one time we can import. There is no need of, I would say, reinventing the wheel. Why not we invent a one-time good SAP system or something which can be used in all the hospitals? Right now, most of the hospital, if you see, what is the problem? The nurses are busy in filling the data form. The residents are busy in filling the investigation form, the detail form. Why this audio transformation into a data which can automatically convert into a document in electronic form is not being applied? So when you see to the corona ward, especially places like us where almost 600 patients of corona and 300-400 alag, most of these hospitals are suffering because of lack of application of IT at the ground level. There is so much euphoria about Infosys, Tata, TCS, and others, but in real life, even the rich central government hospitals are suffering immensely. They are not able to generate. Suppose the lab generates a report. Automatically, it should be available in EHR on any computer screen with the right to access. That point should be there. That is not there as on today. So I sincerely respect Sunil Kumar ji on DDG NIC. But when I see on the ground level, I find, oh, we learned the laptop in 91 and this is 2020. 30 years has gone, but still our system is not user friendly. On the ground level, the patients are troubled. They are not getting the information about who is in the corona ward. There is a communication gap. There is a delivery gap. There is a gap in the analysis of what is the requirement in the ward, what is available in the store, what has to be bought. That gap is there. So there are multiple issues which can be solved easily by technology. So I will not actually talk about what is the hi-fi which should be done, which I know, but I'll not talk today. I'm simply putting my point that central government top level institutions are suffering because of lack of uniform high level technology, lack of uniform access of, suppose there is some blood creatinine level is done. If I got an access, why can't I see on my mobile as a faculty? If I got some hi-fi investigation done, any lab, why can't I see on my computer screen immediately? Answer is no. 98% of, I'm not talking state government hospital, 98% of central government hospitals do not have access to world-class data everywhere and which is not uniform. Suppose a patient is transferred from Patna to my side, or my patient is transferred to PGI Chandigarh or to Delhi, or Delhi patient is transferred to me. The data is not transferred to me. It does not happen. There is a bottleneck. We don't know what has happened there. So there should be another thing which is important, that the patient consent must be there somewhere when the data is transferred. Who can see what data and who cannot see what data? I have seen in medical legal cases this is a major issue. The access code must be very well defined. What only the patient will release, what the hospital can release, and what anyone can see. There should be 3-4 grade of confidentiality clause which should be there. So I still feel there are a lot of issues in technology. We have achieved only 5% of our capability in India. We are way behind, and we need it desperately and quickly. Thank you.
Can I reply to some of the issues raised by you?
We are welcome. Sunilji, actually, honestly, I would like to you that you can visit us electronically or you can visit us physically. You will understand how much correspondence we do with NIC with no result. As simple as that some project was started, suppose in 2018. Right now, for 2 months, we are fighting that your bill should be from 2016. I'm saying केंद्र सरकार का पैसा है, केंद्र सरकार को जाना है, 2 डिपार्टमेंट इतनी मुश्किल से लड़े हुए हैं, सॉल्व नहीं हो रहा. So we would invite you electronically or physically anytime. Welcome, Chief.
Sir, I will definitely contact you, and we will hold a VC-based meeting, keeping COVID-19 in view. I agree with all the points. So it's not the creation of EHR is cannot be only through technologies, because creation of EHR is through health professionals, maybe nurses, maybe doctors, maybe. So somebody has to digitize the data, which is so both hands have to work together, especially technologist and the healthcare professional. They need to work together. So if there are facilities available in the software to capture the electronic health record. So if data is not entered, so it cannot be made available. It cannot be, electronic health record cannot be captured. As far as audio, capturing the data through audio solutions, I fully respect that part. And but my submission is that we have tried to apply it in 1 or 2 hospitals. See, if it gives some error records, and error cannot be accepted in a medical record, because it can create threat to the life. So we are trying to resolve those issues.
Sunilji, I will intervene and give you one very interesting information. 1991, I was in University London. We used to give the audio report on X-ray or CT on patient. That was sent to Bangalore. That was transcribed and sent back to us in a written form. This was 1991. So this is nothing new. My point is, what has happened in the world all over, we have not kept pace with the rapidly changing philosophy. We are not getting feedback from the users. The user will give you the feedback, what is the problem. We are going so much top heavy, but in which the user, which is the nurse, the doctor, the real people who are working, their point, if you don't take, it will not excel. That is my point. It's a very polite point. Please take the feedback from the user. Okay, so many days e-hospital is running in AIIMS Rishikesh. What is your problem? You have never sent me email like that. We have been writing our problems, but nobody has asked us.
The simple answer to all your queries is, I will contact you. We will hold a series of discussions and find out the solution for that.
Welcome. Thank you. I'm so grateful. I'm obliged. Welcome.
So as we are running it's like running out of time, right? So I'd like it's like basically there's it's like after one last this thing your last thoughts,
I would
then we'll
like
have
to intervene a little bit. That's why we fell out.
yes sir, please.
Yeah, I fully agree with Professor Kant. So there are issues, but in technology, it's two-way part. Only technology cannot help. So there are definitely people. We have started an e-prescription, voice-based e-prescription in West Bengal, which is running successfully with some parameters. And if someone can come from AIIMS Rishikesh, we can show them a demo. It's running since last 3-4 years. And my intention was to, it is only running in oncology department as of now. Intention was to expand it to other departments. We tried it, but because of COVID, we have stopped the project as of now. So that can be seen, and it can be replicated. We'll be happy to basically transfer the technology to them.
So with this, I think so we'll just have 1 minute of the closing remark from everyone. Then there are 2-3 questions I would like to put up to the speakers here. So with Mr. Sunil sir, I would like to your last closing remark about this technology, how technology in health is helping the healthcare ecosystem. So your 1 minute, sir, to you.
It is definitely helping healthcare, but I think say co-panelists, they have very well articulated the idea that there is a need for integration between the systems, and it has to happen. Government of India has already taken the initiative by way of creating NDHM, National Digital Health Mission, and 5 initiatives: Health ID, HFR, DigiDoctor, consent management of the patient, and the electronic health record. So I am hopeful that all system electronic where electronic health record is being created, that will talk to each other, and citizen of this country will get electronic health record on their mobile in near future to come.
Professor Ravikant, your 2 cents, please. Professor Ravikant, you there? So I'll move to Mr. Subramaniam. Subramaniam, sir, anything? It's like your 1 minute. You have got 1 minute to basically talk about sum this up, basically, if I talk about.
Right. Yeah, information technology, of course, is doing a great job in terms of bringing in transparency of information, as well as getting in more digitization, so it's more accessible to people. Of course, on the other end, there are also technologies that we are working on around modern systems which can improve the healthcare and the environment, including acoustics, including air quality, as well as sanitization of premises. So I think healthcare is only bound to get better after this crisis. What, as they say, what cannot kill you can only make you better or make you stronger. So I think we'll all get much more stronger, more wiser at the end of all of this. Thanks.
Dr. Abhishek Roy.
Yeah. See, technology can definitely do wonders in health or any segment. But as we know, e-governance or anything with respect to public, it has to be accepted by all the stakeholders. As of now, all the stakeholders are not willing to adapt it. See, as people basically are not willing to accept the change. We started an online OPD system wherein we saw that there are long queues in our government hospitals for OPD checkup. We started an online OPD system wherein you can just book and slot through a mobile, your computer or any thing. But only thing is that you need to give your ID, either Aadhaar or voter ID card or anything else. In spite of that system, people basically opted to stand in a queue and get the OPD checkup done because they don't want to share their some documents, identity documents. So it has to be accepted by all. We started this voice-based e-prescription in some hospitals. Few doctors were willing to support us. They gave us their time because unless their medical terminologies are captured and reiterated in the system, it will not work properly. A few doctors are willing to support, and unless they support, technologies cannot do anything. We need the support of the doctors, the nurses, the ward boys, the technicians, others, all medical technology people to help us in getting this entire technology adapted there. We are ready to help. It's not a one-day process. It's an iterative process. So mindset has to be that, okay, we'll adapt the technology. Whenever we go with a laptop, they start, no, go, throw away. I'll give an example of e-prescription in West Bengal. When we started with a basically typing system. So doctor said we don't have time to type. Then we started with drop-down system. They told we don't have even time for a drop-down. But now slowly they have adapted the drop-down system, and now we are coming with a voice-based e-prescription, which is running successfully since last 2.5 years in oncology department. And it is supposed to be in gastro also. It was the POC was successful. We are supposed to launch it. Each department asking for a separate prescription for them. Eye is asking for their photographs of the eyes with all the pointers. We are trying to develop it, but because of COVID, we have stopped it. So this all from my side. It needs a coordination between all the stakeholders. Otherwise, technology cannot do anything. Thank you.
Dr. T. Arun, you're there? No, I don't think so. So, sir, Sunil sir, there is a question for you. So the question is, all the available applications developed by NIC are cloud and SaaS based. So so that any hospitals can adopt. So means like any hospitals can adopt it, or like it's only for the public healthcare, this thing. So you're mute.
Yes, e-hospital and other solutions, all the solutions are cloud-based solutions. So their adoption, see, only hospital need to have internet connectivity, local area network, and the PCs. Nothing else is required. All the server-side management, software, and hosting platform, everything will be is already being provided by NIC. So, and integration, I have told you that integration of these applications, silos application, they are being integrated through NDHM component recently created by National Digital Health Mission.
So I think the question is something else. They want to ask you whether any private hospitals can adapt the NIC system or not.
Private sector, we are coming up with a different model for on charging basis. We are working on that. Our organization called NICSI, they are working out the cost. So how the infrastructure cost and other thing component will be able to charge accordingly. So it is a SaaS-based solution, so it should not be a problem. We will come up within 3 to 4 months. We will be able to offer it to private sector also.
There's a question to all the speakers who represent the government here. So the question is, why can't government health department use private players in mass healthcare, especially in rural and semi-urban areas? Because government alone cannot provide the round-the-clock health services. Digital health startups are key to making healthcare access to mass. So how do you think involving a private or it's like a startup of a startup healthcare organizations to reach out to the rural areas, and it's like, because delivering is another important aspect which we need to take care into the healthcare ecosystem.
Fahim, if you see the data today, 80% of expenditure, 80% of treatment is by a private practitioner only in India. That is the data today. Only 20% of treatment is by the government sector. So already private sector is at 80% level, right? And this fact is well known by the, what you call it, our differential various type of census. We know this data. So it is there. Only thing we need to do, electronic uniformity of how to transfer, which to my mind must be Aadhaar based. I have no confusion about it. Without Aadhaar based, I'll not accept anything. I want one person, same data anywhere. But 80% of patients, 80% of expenditure on health is by private sector. Thank you.
Thank you, sir.
Sir, I would like to add one more point here. West Bengal has already started taking help from private sectors. We have in our all the hospitals and district health centers implemented fair price diagnostic system and fair price medicine system. In fair price diagnostic system, all private operators through a tendering mode have been asked to operate the diagnostic system in the government hospitals. We have given free place to them, and we pay for all those diagnostics for government prescribed applications, and they are free to take private patients for the diagnostics. This we have implemented, and it's running successfully since last 3 years.
Okay. And the question to Mr. Subramaniam is basically, do you have any because when you talked about better hygiene, BioGuard, indoor quality, LED technology. So, is there any case study or any live cases which you can refer to, like how you have helped basically the if you talk about even a hospital with regards to your technology?
Right. Thanks for this question. It's an excellent question, Fahim. Today, we are working with a lot of these AIIMS that are coming around India. In fact, AIIMS Rishikesh is also one of our a very large case study where Knauf ceilings have been used and tested to a great extent. Of course, I mean, a lot of these places are actually a lot of government premises have actually, in fact, to be very honest, government has been the forerunner to adopt these kind of technologies even before a lot of private players. So we have actually done a lot of work around this. And of course, whenever we are launching new products, what we are also trying to do is bring in some pilot cases, and we'd be happy to kind of work with a few of the people out here to maybe put in a small area to show or actually go back and take actual data before and after kind of data on whether it is acoustics or whether it is hygiene or anything else. We'd be more than happy to do a pilot and take back inputs back to our product development. In short, I think we are working very closely with a lot of government stakeholders as well as private players. And of course, on the other end of the spectrum, we are also working on a lot of international researchers to come back with a lot of cutting edge technologies and how this could be applied into an actual scenario. I hope this answers the question.
Yeah. Yes, actually. So I think so. It was a very interesting panel with Mr. Sunil Kumar talking about the NIC technologies and the softwares, the SaaS-based technology which they are providing. Then Dr. Abhishek Roy talking about the integrity of the of technology and the data. Then Subramaniam talking about the various key solutions which Knauf solutions are bringing in on for the healthcare sector. Then Dr. Arun, he also talked about the healthcare ecosystem, the scenarios of of the Puducherry government, because the Puducherry government. Professor Ravikant was there. He was also he had some queries, some questions. So I think so that can be well handled at the one-on-one with Mr. Sunil. So I would like to thank you. I'd like to thank you everyone for being a part of this, and thank you, sir. And I look forward to having you in our future conferences also. Though Dr. Abhishek Rao, Mr. Sunil Kumar, Professor Ravikant, Dr. Arun, they are already part of. They have been already part of our various conclaves in the past. So thank you, sir. It was pleasure having you all here. With this, I would like to say goodbye and stay safe, stay healthy. Thank you.
Thank you. Thanks a lot.
Thanks for him and thanks everybody. Bye-bye. Have a good day.